Start.
Hello everyone. My presentation is about MOPS infection. Next slide, please. MOPS is a viral infection that primarily affect salivia producing salivary gland that are located near your ears. MOPS can cause swelling in one or both of these glands. MOPS was common in the United States until MOPS vaccination became routine. Since then, the number of cases has dropped dramatically. However, MOPS outbreak still occur in the United States, and the number of the cases has crept up in recent years. These outbreaks generally affect people who are not vaccinated and occur in close contact settings such as school or college campus. Causes of MOPS. The MOPS are caused by a viral called the paramyxovirus. It can be transmitted by a respiratory secretion, example salivia from person already affected with the condition. When contracting MOPS, the virus travel from the respiratory tract to the salivary gland and reproduce, causing the gland to swell. Example of how MOPS can be spread include sneezing or coughing, using the same cutlery and plate as the infected person, sharing food and drink with someone who is infected, an infected person touching their nose or mouth and then passing into a surface that someone else may touch. Individuals infected with the most virus are contagious for approximately 15 days. Pathophysiology. The MOPS virus is transmitted by a respiratory droplet, a direct contact, or contaminated vomits. It has an incubation period of 14 till 18 days, ranging from 12 to 25 days after initial transmission. After the incubation period, prodromal symptoms occur and lasts anywhere from 3 to 5 days. After the prodrome, the symptoms of the virus depend on which organ is affected. The most common presentation is parotitis, which occurs in 30 to 40% of the patient. Other reported sites of infection are the testes, pancreas, eyes, ovaries, central nervous system, giant, and kidney. A patient is considered infectious from about 3 days before the illness and up to 4 days after the start of active parotitis. Infection can be asymptomatic in up to 20% of person. Complication of MOPS. Complications are more frequent in adults than children. The most common are orchitis, testes swell and become painful. This happens to 1 in 5 adult males with MOPS. The swelling normally goes down within one week. Tenderness can last longer than that. This result this rarely result in infertility. Uh, uh, ovaries swell and are painful. It occurs in 1 in 20 adult female. The swelling will subside as the immune system fight off the virus. This rarely results in infertility. Brain viral infections such as MOPS can lead to inflammation of the brain. Encephalitis can cause a neurological problem and become life-threatening. Inflamed pancreatitis pain will be experienced in the upper abdomen. This occurs in 1 out of 20 cases and is usually mild. Hearing loss can occur in one or both ears. Although rare, the hearing loss is sometimes permanent. Heart problem rarely moves has been associated with abnormal heartbeat and disease of the heart muscle. If a pregnant woman contract MOPS in the first 12 to 16 weeks of her pregnancy, she will have a slightly increased risk of the miscarriage. Symptoms: pain in the swollen salivary gland on the one or both side of your face, pain while chewing or swallowing, fever, headache, muscle aches, weakness and fatigue, loss of appetite. Prevention of MOPS. MOPS vaccine is the best way to decrease your risk of getting MOPS. It is usually given as a part of a combination vaccine that protect against three virus muscles, rob, muscles, rubella. The first MMR shot is generally given between the age of 12 and 15 months at a routine well child visit. A second vaccination is necessary for a school child age between 4 and 6 year old. With two doses, the MOPS vaccine is approximately 88% effective. Adults who were born before 1957 and haven't yet contracted MOPS may wish to be vaccinated. Those who work in a high risk environment such as hospital or a school should always be vaccinated against MOPS. Individuals are not advised to have the MMR vaccine if the patient immune system is seriously compromised. The patient has had allergic reaction to onomycin, a type of antibiotic, or gelatin. The patient is pregnant or soon to be pregnant in the next 4 weeks. MMR vaccine side effect: most people given the MMR vaccine do not suffer side effect, and disease itself cannot be contracted from the vaccine. A small percentage might develop a rash or fever and possibly aches in their joints. Next, please. MOPS and SARS. During the 2003 epidemic of severe acute respiratory syndrome, SARS, it was thought that the SARS causing virus belonging to Behdad family. However, coronavirus
Hello,
Hello.
can you all hear him?
Yes, yes.
I
Yes.
lost your voice. Okay, okay, carry on.
Okay. However, current case criteria have determined that SARS followed the clinical laboratory and transmission characteristics of an RNA coronavirus named SARS associated coronavirus. SARS conspiracy theory. The SARS conspiracy theory began to emerge during the SARS outbreak in China in the spring 2003 when Sergei Klashnikov, a Russian scientist and a member of the Russian Academy of Medical Science, first publicate his claim that the SARS coronavirus is a synthesis of the measles and mumps. According to Kalashnikov, this combination cannot be formed in the natural world, and thus the SARS virus must have been produced under laboratory conditions. Another Russian scientist, Nikolai Filatov, head of Moscow epidemiological services, had earlier commented that the SARS virus was probably man-made. However, independent lab concluded this claim to be premature since the SARS virus is a coronavirus, whereas measles and mumps are paramyxi virus. These primary difference between coronavirus and paramyxovirus are in their structure and method of infection, thus making it implausible for coronavirus to have been created from two paramyxovirus. Next, please. Risk factor: lack of immunization, international travel, and immunodeficiency are all a factor that increase risk of infection by the paramyxovirus mumps virus. Test and diagnosis of the mumps. Normally, mumps can be diagnosed by its symptoms alone, especially by examining the facial swelling. A doctor might also check inside the mouth to see the position of tonsil. When infected with the mumps, a person's tonsil can get pushed to the side. Take the patient's temperature. Take sample of the CSF cerebrospinal fluid from the spine for testing. This is usually only in severe cases. Laboratory diagnosis: during mumps infection, several non-specific findings may be present in the blood. The WBC may be low with lymphocyte predominating. ESR and the CRP may be normal or slightly elevated. Amylase level may be elevated. Serological diagnosis is usually made by finding a significant increase in antibody titers in two serum samples taken 10 till 14 days apart. In some cases, the detection of the IgM may be used to diagnose acute infection. Although only one serotype of the MOPS exists, cross reaction between mumps virus and the paramyxi virus makes serological result difficult to interpretation equation. CFT, compilation fixation test. The CFT is still the widely used for the diagnosis of mumps. Two antigenic preparation are commonly used: the V antigen and the S antigen. Antibody against S appears early and are short-lived, while antibody to V antigen appear slowly but persist longer. By comparing titer using the two different antigens, it is often possible to make serological diagnosis early in the course of illness. However, due to problem with the cross reactivity, a paired serum sample is always needed for reliable by CFT. HAI, this test measure antibodies similar to those reacting with the V antigen in the CF test. Neutralization test. Virus neutralization has long been regarded as the most reliable serological marker for immunity, but it is very tedious to carry out and thus rarely used. Virus isolation may be carried out by allotonic inoculation of 60-old embryonate eggs or by tissue culture method. Virus can be isolated from the CSF during the first 2 till 3 days after the onset of disease and is present in urine and saliva for 2 to 3 weeks. Monkey kidney cells are generally used for virus isolation. mumps treatment, there is no medicine to treat mumps. It is usually go away on its own within 2 weeks. This treatment, uh, this this treatment step should be following. Drink plenty of fluid. If the glands are swollen and causing discomfort, ice or heat packs can help ease the pain. Non-aspirin medications such as acetaminophen and ibuprofen can be used to bring fever under control and help with pain from swelling gland. Do not give your children aspirin. Children with virus such as mumps who take aspirin can develop Rey syndrome. Patient education. Advise patient and educator to exclude infected children from large population facility until 9 days after parotid swelling or until this swelling subside. Advise all children and adults to follow good hand washing practice. If your children has a mob, it's important to prevent the infection spreading, particularly to young people born between 1918 and 1990. These people are unlikely to have immunity from a previous infection and are unlikely to have been vaccinated. The best way to do this is stay away from school, college, or work until 5 days after your first development symptoms. Always use tissue to cover your mouth and nose when you cough and sneeze, and throw the tissue in a bin immediately afterward. Thank you.
Yes, thank you, Behdad. I think it was really nice topic selection in terms of selection of topic, and then even the information. We don't this is something we don't happen to read in our curriculum, and very general. Okay, we take the vaccine, no MMR, measles, mumps, rubella
Yes, sir.
vaccine, and he also correlated with the coronavirus and SARS, and then I think for the fifth year I have taught the viral drug interaction in the drug interaction chapter. Okay, so that also mechanism you can again brush it up how it happens. For example, you are not supposed to give NSAID in case of this measles viral infection. So paramyxo virus. Okay,
Yes, sir.
interesting. This is something I really liked. Okay, so audiences, if you have any particular question to Behdad, you can ask him. Audiences, anybody have any queries?
No, we don't have any question.
No, sir.
Okay, so we'll move to the next presentation.
Okay,
Who is
thank
that?
you, sir.
Next one.